Hello dear viewers, and we're back again right here. Good morning Kuwait with our first guest. But before that, let's do a small introduction. So joint and rheumatic diseases affect millions of people worldwide, often impacting mobility, independence, and overall quality of life. Advances in diagnosis and treatment have transformed the way these conditions are managed, making early awareness and intervention more important than ever. To shed light on this important health topic, we are pleased to welcome Dr. Khaled Aldoub, Vice President of the Kuwait Rheumatology Association and Senior Specialist in Rheumatology and Joint Diseases with extensive experience in the diagnosis and treatment of rheumatic and autoimmune disorder. He plays a key role in promoting awareness, advancing patient care, and supporting healthier lives across the community. And Dr. Khaled, welcome to the show, and how are you?
Thank you for inviting me. It's a pleasure to be back in your show.
All right. So as a first question to begin with, could you explain what rheumatic diseases are and how they affect a person's life quality on a daily basis?
So nowadays, you always hear the word rheumatism in every house, in every place. So what does rheumatism mean? It basically means joint pain or joint problems, to be precise. So it might be a pain, might be joint swelling, fatigue, stiffness of the joint. So these symptoms, they manifest, these diseases, they manifest in these symptoms. Of course, there are a variety of rheumatic disorders. They are divided into two main types. Mainly the mechanical, which is the wear and tear, such as the osteoarthritis, the injury, the degenerative diseases. The other type is the inflammatory type, which is about rheumatoid arthritis, lupus, gout, and other inflammatory diseases.
So when we're talking about rheumatism in general, is it something that can be affected genetically and also by ethnicity?
So definitely there is some involvement of the genetic predisposition. I would say this is an irreversible factor. Okay. So some patients have genetic predisposition to develop such disorders, and then the environmental factors comes in and triggers these genetic factors. So like such as smoking, sedentary lifestyle, physical inactivity, stressful lifestyle, infections, recurrent infection, I would say, particularly gum infection and recurrent gastroenteritis can also lead to triggering these diseases.
All right. It's very interesting that something that even oral can affect, going down to the gastritis, can affect the rheumatism problems.
They do, because if you understand the autoimmune inflammatory diseases, they are related to the immune system. So what happens if you have an infection? Your immune system gets activated.
Of course.
But if you have the genetic predisposition to develop such diseases, your immune system will be overactivated. So it will manifest by causing joint pain, joint swelling, stiffness, fatigue, and other manifestation of the joint.
Understood. So many people tend to ignore joint pain. So when is the right time that people should not be persisting on ignoring it and starting to seek actual professional help?
So the key symptoms, I would say, is recurrent or persistent joint problems. Not just pain, but also swelling, stiffness, particularly morning stiffness, limited or reduced mobility of the joint. All of these are important symptoms, and of course if you tackle these problems early, you will prevent damage and irreversible disability of the joints.
All right. You've said that there are many types of rheumatism diseases, but what is the most common that is in Kuwait generally?
So I would say Kuwait's data are similar to worldwide. The most common, or I would say the top 3 rheumatic disorders. The first is osteoarthritis, which is wear and tear of the joint or degeneration of the joint. The second one would be rheumatoid arthritis, which is the inflammatory arthritis of the small joints of the hand, to be precise. The third one would be gout, which is related to uric acid crystals deposition inside the joints.
And what does actually causes the last one, which is gout?
So I would say sedentary lifestyle or like fast food or junk food habits will increase the levels of uric acid in your body.
Okay.
And then your body will start to crystallize this uric acid, and they will start to be deposited on certain joints.
You mean fast food as in they have a high in sodium? So that
not sodium, but uric acid.
Uric acid in itself?
Yes.
Okay. So rheumatoid arthritis is one of the most recognized rheumatic condition. What are the early signs that people should watch out for when dealing with this type of disease?
Sorry, can you repeat the question?
The rheumatoid arthritis.
Rheumatoid.
Yes, it's one of the most known or the most basically popular, intense type of diseases. So what are the signs that someone that should watch out for so that they can understand that this is one of the common ones?
So always remember the key symptoms that I mentioned before, which are the persistent and recurrent joint pain.
Okay.
And rheumatoid arthritis, just remember the small joints of the hands. So there will be pain and swelling of the small joints of the hands, particularly the fingers and the wrist as well. There will be morning stiffness. Usually the morning stiffness can last beyond 1 hour. The patient will have difficulty in moving their hand. And of course, with time, this can cause irreversible damage to the joint. I'm sure everybody have seen the images of the damage caused by rheumatoid arthritis. We don't see these images nowadays because now in the era of the biological therapy or the modern therapy to target and treat the rheumatoid arthritis early and prevent damage.
Is there any home remedies that someone can go through to actually avoid it, or exercises?
So home remedies are adjuvant therapy rather than the main therapy. So there is no specific study that can elaborate which home remedy is helpful. But I would say in general, any auto-inflammatory, any antioxidant therapy would be helpful, such as turmeric, such as omega-3. These things, they can prevent inflammation, so hence will lower the inflammation of the autoimmune disease.
What about exercises?
Definitely, exercises have a crucial role in maintaining health and preventing further relapses of the disease. So the American Association of Rheumatology have listed a set of guidelines, what type of exercise is beneficial. And for rheumatoid arthritis in particular, there are 4 types of exercises. So number 1 is the aerobic exercises, cycling, jogging. Number 2 is swimming. Number 3 is the stretching exercises such as yoga or Pilates. And number 4 is resistance exercises. So resistance exercises is actually recommended rather than what everybody thinks that it should be avoided, but it should be recommended actually.
All right. So how important is early diagnosis in preventing long-term joint damage and disability among patients, specifically that with rheumatic diseases?
So as I said, early diagnosis is really crucial because it can identify the disease early and prevent irreversible damage of the joint. So if you cut the disease early, there are many manifestations many complications, I would say, of that disease. Not just the joint manifestation, but it can affect the eye, causes inflammation of the eye. It can affect the lung, causes lung fibrosis. It can affect the kidney, causes kidney damage. It can even affect the vessels of the heart, the coronary vessel of the heart. So it can cause premature atherosclerosis and ischemic heart disease. So, and anemia, osteoporosis. So there are many lists of complications. We can prevent all of that if we can early identify the disease and treat it early.
So it's like a domino effect, basically. One thing starts and then it just complicates even more into the body.
That's absolutely correct. So if you tackle it early, you would stop that domino effect.
All right. So what role do lifestyle factors such as diet, physical activity, sleep, specifically sleep, and stress management play in maintaining joint health?
So we already mentioned about exercise. Let's talk about other lifestyle. So it's important to maintain a healthy lifestyle. This will prevent the oxidative state of the disease, the inflammation of the disease. So a healthy lifestyle starts with a healthy food habit. So usually the recommended type of diet for such diseases is the Mediterranean diet. I'm sure you've heard about it.
Yes.
So it's actually proven in studies that it helps against inflammation. The other thing is stressful lifestyle. So try to limit the levels of stress, because stress can trigger inflammation. It can even trigger the disease itself in the beginning. Of course, maintaining this all will maintain a healthy environment, and it will control the type of inflammation.
And we always stress to people that sleep is very important, not just for physical but also mental health. People don't understand even your mental health can affect your physical health. It can actually trigger things that you might not know.
You're absolutely right. So it's like a vicious cycle. So if you're sleep deprived, it will further damage your immune system. The immune system will further trigger the joint pain and inflammation. So you have to cut that vicious cycle. And of course will also cause further stress if you don't sleep in. people who have insomnia.
All right. So medical advancements in rheumatology have been remarkable in recent years. What are some of the latest treatment opinions or options available for patients?
So previously we had the immunosuppressive therapy, which are medications that can alter the immune system, because we already said that the immune system is damaged, it's exaggerated, it's overacting, so it's damaging the joint. These medications, they used to work fine, but they have a number of side effects. Now we're in the era of the modern therapy, the targeted therapy, which are called the biological therapy. The biological therapy, they target a specific cell that causes that inflammation. So in that way, it will be more efficacious, more effective, and it will limit the side effect, because it's only tackling that type of immune cell, not the whole immune system.
All right.
So that's why patients who are on biological therapy are really happy, because their disease is completely controlled. So now we're not just targeting stopping the complications, but we're targeting a normal lifestyle. So a patient can go to their daily activity without limitation of their activity.
Very true. Now, being the Vice President of Kuwait Rheumatology Association, what message do you have for dear viewers and everyone that is tuning in into this wonderful program, Good Morning Kuwait? Basically, what message do you have to them to, to make sure that they're in the right path of taking care of themselves and avoiding such diseases?
So as former Vice President of the Kuwait Association of Rheumatology, I will always advise not to neglect such symptoms. So if you have symptoms that are recurrent, something that's persistent, a large number of joints that are affected, there is something going on. It's better to have it checked early, get a medical evaluation. If you have it checked early, as I said, you will prevent further damage. And if the disease is early, you can control it really easily. But if it progressed further, it will be more difficult. And it will be difficult to prevent long-term damage and complications if you don't get it early. So always remember, persistent and recurrent joint problem, visit a doctor to get a medical evaluation.
Well, that's how your body basically speaks to you, by actually telling you signs and making you feel things so that you can go and seek professional help.
Well said, I would say.
All right. Thank you so much for being with us, Dr. Khaled, and we hope to see you soon in other basically episodes with us. Why not?
It's my pleasure. Thank you for inviting me again.
Thank you so much. Now, all thanks to our dear guests. And with that, how about we go watch a short break, and we'll be right back right after this.